In the past few months there seems to have been a lot of negative press about vets, and it's made me want to come out and defend my profession and explain why we do what we do, how hard we work, and how actually the huge majority of vets represent extremely good value for money and really genuinely have the best interests of their clients and their patients at heart. Vets are a caring profession. We went into being vets because we cared about animals and we wanted to help make them better. But that often places us in very difficult moral dilemmas, particularly when we're faced with a sick animal and an owner who can't necessarily afford to pay for their care. A lot of vets perform discounted work or charge less than they should in order to help make an animal better. Our instincts as a profession is always to help the animal, but this isn't always possible if the owner can't afford it. But it's important to remember that vets are private businesses. They have to charge properly for their services. They have to turn a profit. There are costs involved, wages for staff and equipment. But it is very, very difficult when someone brings you a poorly animal and wants you to help them make it better, but they don't have the funds to be able to do that. With the NHS in this country, it's difficult for people to understand the true costs of medical and surgical care. And certainly a lot of the television programmes which feature vets concentrate on the charity clinics, the RSPCA and the PDSA. And again, in these programmes, the issues of the cost of the treatment of the animals doesn't come up because it's all free to the people who qualify for their care. So I think it can be difficult sometimes for people to, obviously people understand that you have to pay for veterinary care, but to understand really the costs that are involved and the true cost of medical and surgical care for their pets. Take, for example, a routine bitch spay, which to all intents and purposes is a hysterectomy. The cost will vary on the size of the dog and where exactly in the country you are, but you're going to be expecting to pay between about £100 and £200 depending on the clinic. Now, if we take the example of a hysterectomy on a woman on the NHS, the cost is bound to run into several £1,000s. And the standard of care that's given isn't that much different. Each will involve a qualified surgeon, a nurse to help them, at least one, pre-care and aftercare as well. So that's one example of how vets really can represent really great value for money. It is your responsibility to care for the health and the welfare of your pet, and that will include paying for their veterinary needs. Obviously, there are charities that exist to help people who maybe are on low incomes, who can't afford veterinary care, the PDSA, the RSPCA, the Blue Cross, the CPL. They all exist, but they are not available for everyone. And it is really up to the individual owner to ensure that they have made provisions for their pet's healthcare. I tend to get into the clinic about 8:30 in the morning, and then I work through the day. I consult, I operate, I'll report blood results. We're not the NHS. Bloods tend to be reported back to patients within 24 to 48 hours. I'm often on the phone discussing ongoing care with people, and I rarely leave the clinic before about 6:30 or 7:30 at night. And this is the same for the huge majority of my profession. Not forgetting veterinary nurses who work alongside us and work just as hard. And they, sometimes even more than vets, really care for the animals. We're all in it because we love and care for animals. And we enjoy working with clients, the owners, to help make their pets better. Some of these programmes have highlighted the potential exploitation of that important bond between a pet and the owner. And it just serves to destroy the trust between the vet and the owner. And that for me is just really depressing, because all I want to do is work with people to help make their pets better.